Hi, my name is Christine Kernath, and I'm one of the nurse practitioners here at Thompson Healthcare. I'm also Director of Nursing, and today I wanted to discuss the role of the nurse practitioner and how we function in this practice. My background is an adult nurse practitioner, and on staff here we're fortunate enough to have 9 nurse practitioners. They're all certified by either the AANP, the American Association of Nurse Practitioners, or the AANC, the American Association of Nurse Credentials. What I'd like to do is just share some of what how we function here, what we do in our role here in the practice. Since it's a multidisciplinary practice, we function very autonomously. We are referred patients when they come in and they see the chiropractor. They're referred to us if they need any of our medical services. So just an example, these are some of the durable medical equipment that we can administer and prescribe for our patients. We use something like this, which is a TLSO, a thoracic lumbar sacral orthotic. What that is basically for some postural issues and concerns, which we have many patients, especially since the advent of COVID, with so many people working remotely. We have back braces and LSO. We do orthotic fitting, posture braces. We also can function with getting patients out of pain with different measures, actually prescribing anti-inflammatories. We can do trigger point injections. We do joint injections. In fact, I'll speak later to one of my patients as an example of how I assessed her needs. When she first came into our practice, she saw Dr. Travis for low back pain, and we both evaluated her and felt like a lot of her issues with the back were actually coming from her knees. So I worked her up for arthritis, and we did find that she was positive for OA in both knees, and we offered her some of the options that we do here for the joint injections. So if you have any questions and need help medically, speak with your chiropractor. We also do referrals to the other services, which we have so many here: occupational therapy, physical therapy, and acupuncture. Many of our patients utilize all of these services to help them get out of pain and keep them out of pain. But today I'm going to share my experience with one of my favorite patients, Diane, who came to us. When did you actually start, Diane?
Oh, for years I've been coming to Thompson.
Right.
I would say at least 3 or 4 years.
Yeah, I believe she started in the Lacey office and
Right.
has since moved up to this area, so she transferred over, which many patients do. And actually, when she came to us, she was complaining of her main concern was low back pain. And when Dr. Travis first examined her and started treating her, we both felt that it was really coming from her knees. Her gait was definitely affected. She was limping, and I think having more decreased mobility around the house just with her ADLs. So what I did was I ordered x-rays for her, and we basically were trying to rule out osteoarthritis. They came back positive, confirmed in both knees. So I offered her one of the treatments that we do quite often here, which is Genvisc. It's covered by her insurance. She's a Medicare patient, and it's a series of 5 injections that we did, 1 in each knee, for the 5 weeks. And we just finished it today, actually, so it's a good day to kind of see, you know, what her outcome was. It seems like it's been pretty good. We just finished doing the injection here. I do it under ultrasound guidance, and then we're going to have you go outside after your other therapies and just do some ice and elevate it. Do you feel like it's helped?
Yes, it has helped. It has helped, especially this knee. It's really, I don't get the pain anymore. This knee, I have rheumatoid arthritis, so I still get some pain, but nothing like before. I mean, I can walk now more freely than before and without getting the pain.
Right. And since she mentioned the RA, I didn't want to divulge that because of HIPAA, but very often then you don't want to use any of the steroids or the cortisone just for pain relief, because she's also on Humira. Right. And those are definitely contraindications to that. So this was a great option for her to hopefully get you out of pain, keep you out of pain, which is our motto here. And your mobility is better.
Yes, much better than mobility.
Great.
Getting up out of a chair is much better, because I would get up and I'd have to stand so everything could situate and then move. But now I can get up and just walk.
Wonderful. I mean, that's what we like to hear. So I'll follow up with you in a couple weeks to also just see after about a month how things are going and how your pain level is at that point, and we'll reevaluate if we need to do anything further. Thank you, Diana. I
You're
really
welcome, and
appreciate
thank
it.
everybody here for their concerns and their kindness.
Thank you. I wanted to thank everybody for listening and watching our video, and hopefully you've learned something about our role as a nurse practitioner and how Thompson utilizes our services. So if you're interested or having any complaint of pain, please do come look us up, see us, and hopefully get in sooner than later for us to evaluate your potential problem and how we can help. Thank you so much. Have a great day.